Hello, I'm Sandra Melvin, and I am the health chairperson for the Mississippi State Conference of the NAACP. I would like to welcome you to this session entitled Ensuring Equitable Access to Healthcare During COVID-19. In January 2020, the country became aware of a novel coronavirus, COVID-19. Globally, the effects of COVID-19 have been devastating in terms of its impact on the healthcare system, educational system, and the economy. In the United States, there have been over 8 million confirmed cases of COVID-19 and over 225,000 deaths. To date, over 115,000 Mississippians have been infected with COVID-19 and over 3,000 have died. There are still a lot of unanswered questions about plans to address this pandemic and what communities can do to protect themselves and their families. We have two distinguished guests who are working in the community to address this pandemic, Dr. Latanya Washington and Dr. Chigozie Udemba. They will provide you with some valuable information about COVID-19, how to protect yourself from the disease, and how to access healthcare resources. Before we begin with their presentations, I would like to introduce the panelists. The first panelist, Dr. Latanya Washington, is a native Mississippian. She received her Bachelor of Science degree in biology from Tougaloo College and her Doctor of Medicine from the University of Tennessee Health Science Center. She completed her residency training in internal medicine and pediatrics at the University of Arkansas for Medical Sciences, where she also served as chief resident. She obtained a Master of Business Administration from Auburn University. She is board certified in both internal medicine and pediatrics. She has practiced both adult and pediatric medicine in the outpatient and inpatient settings in Virginia, Arkansas, and Tennessee. She is the president of the Bluff City Medical Society, the premier medical organization for physicians of color in Memphis, Tennessee. Dr. Washington is committed to advancing the health care of her community through education, advocacy, and action. Dr. Washington will discuss the effects of COVID-19 on underserved communities. Our next panelist, Dr. Chigozie Udemba, is the director of the Office of Health Equity with the Mississippi State Department of Health. He has experience in working in communities, engaging in different health promotion programming, health education, and community engagement projects. Dr. Udemba has a Doctor of Public Health from Jackson State University and a Master of Science in Health Promotion and Education from the University of Mississippi. He is a certified health education specialist and a certified cultural competency trainer. He is currently serving as the co-lead for the COVID-19 Health Equity Response Unit for the Mississippi State Department of Health. The unit is focused on addressing issues related to COVID-19 in minority communities across the state. During his presentation, Dr. Udemba will highlight and describe the Mississippi State Health Department's efforts to increase access to COVID-19 testing and other services that may be available to underserved communities in the state. So without further ado, we will start with our presentations and we will begin with Dr. Washington.
Hi, everyone. I am Dr. Latanya Washington, and I'll be talking to you a bit today about the impact of COVID-19 on underserved communities. So when we talk about the impact of COVID-19, we really understand that COVID has impacted every aspect of life of the underserved in this country. As we venture into the 9th month of this pandemic, our lives are very different than they were at the beginning of 2020. Our family life is different, our work life, our financial life, and our spiritual lives are completely different than they were at the beginning of this pandemic. So when we talk about the national demographics, this information is from October 26th. We know that there were about 8.7 million cases of COVID-19 in this country and 225,000 American deaths. Those numbers are really astounding. I think that when we first started seeing this disease at the beginning of the year, we never thought that we would be here, but yet here we are. And I'm sure that by the time you are watching this pre-recorded session, that the numbers are going to be much higher. When we talk about the Mississippi numbers, again, these numbers are also from October 26th. 115,000 cases in Mississippi and 3,200 deaths in Mississippi. Those numbers are also astounding when we look at the population of Mississippi. So who do we consider to be the underserved? That term is somewhat all-encompassing. We have elderly patients, we have communities of color, we have patients who are in long-term care facilities, those who are incarcerated, immigrants, uninsured and underinsured persons, and impoverished persons. When we talk about poverty, according to the 2018 census data, 11.8% of Americans live in poverty. And from the 2019 data, 19.6% of Mississippians live below the poverty line, excuse me. It's also important that to understand that there are several groups that are really intersections of the underserved population, meaning that they may be members of different groups. So when we talk about underserved groups, we know that there are disparities, particularly in healthcare. And when we talk about disparities, I want to explain that term. It really means a higher burden of illness, injury, disability, or mortality experienced by one group relative to another. When we talk about disparities, we see disparities in health insurance coverage, in access to and use of healthcare, in the quality of healthcare delivered. Many people have limited affordability of health insurance coverage. We know that many of the southern states, Mississippi being one, failed to expand Medicaid. Also, we know that in our current political climate, there has been a threat to repeal the Affordable Care Act with no published alternative, which will impact many people in the population. And then we also talk about patients who have increased health risk. So those are patients who have heart disease, asthma, diabetes, some types of cancers. Those patients tend to have worse outcomes in general, and particularly as we see COVID-19 data, these patients are the ones that are impacted disproportionately. So when we talk about access to health, what we really mean by that is many patients have limited access to care. You have several patients who don't have an identified primary care provider. They simply only go to seek health care when they're sick. A lot of people are really concerned about the financial implications of seeking health care due to the cost. They may have to pay co-payments. If they don't have insurance, they have to cover the full cost of the clinic visit or the hospital visit. And often patients will delay care due to those concerns. Many people seek care only in the emergency department rather in primary care settings. We know that tends to be more expensive. And particularly the quality of care is much different because when you seek care in the emergency department, those providers usually just take care of the issue that is at hand, and usually the patient is able to go home, or either they become admitted to the hospital. Many people in underserved populations are distrustful of the healthcare system, which also leads to them not seeking care in the healthcare in the hospitals and clinics and emergency departments. When we talk about COVID-19, there have been ongoing talks about access to testing, about increased COVID hospitalizations, about managed care and insurance coverage, and some populations with the limited ability to isolate. So particularly when we talk about COVID-19 and talking about those disparities, there are a lot of terms that we really talk about a lot. One of the things that we don't talk about a lot is systemic racism and how that affects healthcare delivery. We hear a lot of terms talked about, such as the social determinants of health, and it's important to realize that racism is a key factor there. When we talk about healthcare access and utilization, if patients have limited transportation, if the clinics or the hospitals aren't necessarily on the line for public transportation, if there's no bus route close to the patient's home or close to the hospital, then people tend to not seek care. Some people simply can't afford to take time off work, or they are unable to take time off work. Some patients don't like to seek care because of communication barriers, meaning that the doctors may speak over them. Sometimes if they speak different languages, they don't feel comfortable seeking care in that manner. Also, cultural differences tend to be one of the reasons why some patients don't seek care. During the time of COVID-19, we've really seen a surge in the ability of healthcare providers to provide telemedicine services, but we have to recognize that not everyone has access to the internet or a cell phone or Wi-Fi access to be able to really take advantage of those services that are available. And then when we talk about the occupational exposures, even during the time of the shutdown, we had a significant number of essential workers that included healthcare workers, but also other people that kept our lives going. So those were the people that worked at the grocery stores, truck drivers, construction workers, those type of people where if we didn't have those services, then our lives would have come to a screaming halt. They couldn't always take off work. Initially, there wasn't a lot of protection for those individuals. There were mask shortages, so people weren't wearing masks. They have a lot of close contacts, which increases their risk for infection. And a lot of those people don't have benefits in their employment, meaning that they don't get paid sick days. There were also educational, income, and wealth gap disparities, meaning, these patients often had a limited ability to access high quality education. So then they aren't able to get the jobs that maybe provide health insurance coverage. We talked a bit before about the inability for them to miss work. They can't utilize public transportation. Also, when we talk about housing, a lot of people in the underserved populations live in multi-generational households. So that's where grandparents, parents, kids, and grandkids all live in one house. And you can imagine that it's difficult to isolate during those times. A lot of those people are still working outside of the home. So anything that they were exposed to outside, really they brought home with them. So when you have these crowded living conditions, again, these dwellings may not be newer. They may not have adequate ventilation or air conditioning systems. Also, a disproportionate number of those individuals, if they become unemployed, there were lots of layoffs and furloughs initially during this pandemic. They have financial instability. I recently saw a news story that talked about people being evicted from their homes because they lost jobs and were unable to pay their rent. So when we talk about the healthcare financials of COVID-19, it is estimated that up to 2 million uninsured Americans could require hospitalization for COVID-19. That is a number that is kind of hard to swallow. When we talk about the hospital expenses for those patients, it could be about $40 billion. So when we think back to legislation, the CARES Act allocated $100 billion for hospitals and healthcare systems to provide care to patients for COVID-19 testing. But when we think about the hospitals really utilizing about 40% of that money, when we talk about testing, when we talk about other needed care for patients, then we can see that those dollars aren't really going to go a long way. Also, uninsured patients can still really be responsible for the hospital bills if they test negative for COVID and they receive care outside of the hospital. So we understand that for patients who have COVID-19, some patients may not have a positive COVID test, even though they have all of the signs and symptoms of COVID-19. And so when those patients present for hospital care, we treat them as such. So what this is saying is that if those patients have a negative COVID test, then they don't fall under that umbrella. So in that instance, the patients will be responsible for their healthcare costs. So when we talk about what keeps people up at night, I know what has kept me up for countless nights since this pandemic has began is I am really concerned that our healthcare system is at risk for being overwhelmed. We know that marginalized patients, underserved patients, minority patients, elderly patients are at increased risk from dying from COVID-19. Many major metropolitan areas currently have shortages of hospital beds. And so patients may not be able to get the health care that they require. Hospital beds and ICU beds shortages are ongoing. I know for me at my hospital, pretty much for the past week and a half, we've had no beds available in our hospital. Patients are being housed in the emergency department and receiving their care there. I talked to someone today and they said that they only had 3 open rooms in our emergency department to care for patients that were coming in to seek care. And really what we understand is that when resources are scarce and resources have to be reallocated, then the underserved communities will bear the brunt of that burden. Meaning that if there are limited numbers of ventilators, if there are limited number of hospital beds, then they tend to ration the care and give it to those who are more likely to survive or those who have fewer comorbidities. So when we talk about what's next, I mean, really, we are currently experiencing the second wave of COVID-19. We see that in many states throughout the country. Just turn on the news and you'll see that. But we also have to consider that we're coming up on flu season as well. It's very important that everyone gets their flu vaccines this year. I know that we are all wearing masks, and so we would hope that we would be protected. But having COVID-19 and influenza is a bad combination. Early on in the pandemic, in February, March of this year, we had several patients that had both infections, and most of those patients did not survive. And the reality is this country's lax restrictions and poor response in the spring of 2020 is why we are here right now. We understand that COVID isn't going anywhere. We are going to be seeing this infection well into 2021. So we have to be prepared. I hear a lot of people talking about COVID fatigue, like we're tired of restricting ourselves. We're tired of wearing masks. We're tired of not being able to do the things that we enjoy. Well, I don't believe it's going anywhere. And really, with this second wave just starting, my belief is that we're going to continue to see increasing numbers. Very likely, they will be higher than the numbers that we saw earlier in the year. So I'd like to make a shift and talk about the long-term considerations. You know, really, the science is inconclusive on immunity to COVID-19. We see a lot of people who've had COVID, they become lax with wearing their masks. They say, oh, I'm immune. Well, the truth is that we really don't know that. The preliminary reports show that after about 90 days, the immunity goes away. So that means that if people were infected with COVID-19 back in March 2020, here we are in November and you can get COVID again. We are really learning more and more every day about this virus. Even people that had seemingly mild disease or asymptomatic disease have severe debilitating long-term effects. It can cause heart failure. It can cause chronic lung disease. It can cause kidney failure. It can cause blood clots. Really, the potential for damage with this COVID-19 virus is really endless. We have started calling COVID-19 the great imitator, meaning that this virus can really cause any type of symptoms. And one other thing that I really wanted to talk about is at this point, they are really considering COVID-19 a pre-existing condition. So remember earlier in my presentation, I talked about the threat of repeal of the Affordable Care Act. One of the major clauses in that act is the pre-existing condition clause, meaning that they can't deny your insurance coverage because of a pre-existing condition. When we talk about ACA being repealed, then there is a chance that that clause could go away, meaning that if you had COVID-19, The way that they will check that is to see if you have antibodies. You can be denied insurance coverage. And so not only talking about insurance coverage, but talking about other things like life insurance, disability insurance, those types of things, you will be considered higher risk if you are not considered uninsurable at all. So these are all things that we must consider. So the take-home points, COVID-19 really required us to slow down to see the systemic injustices in our community, with healthcare being no exception. We have to remain vigilant. We have to wear masks, social distance, wash our hands, avoid large gatherings. One of the things that I will say, because I know we are coming up on the holiday season, this year for holidays is going to be very different than other years. I am used to having large family gatherings for the holidays, but this year it is not a good idea to do that. If you are considering having holiday gatherings with people who don't live in your home, then my suggestion would be to not do that. If you can do it in a way where you're able to have a setting outside, then that would be safer. It is important that if you are around people who don't live in your household, that you wear masks. Also cautioning against the large family style, potluck style Thanksgiving dinner, because utilizing those utensils, everyone kind of touching, having those high touch surfaces is also an increased risk for infection. I really want everyone to stay safe. We want these numbers to go down. As healthcare workers, we are tired. And we know that you guys are tired as well, but we want everyone to be safe. I don't want to have to walk into my hospital and discuss with my colleagues which patient gets to stay on the ventilator and which patient has to come off. That is not something that I'd like to do. And so I'm asking you, I'm pleading with you to please remain safe. I have some references here. If anyone is interested, feel free to go to those sites. You'll be able to find a lot of the data that I presented here. And then if anyone would like to contact me, I am available on social media and my email address is provided. Thank you.
Thank you so much, Dr. Washington, for providing that valuable information. I think that you gave us some information that we all need to reflect on, and we will be following up on some of the points you made in your presentation during our question and answer session. At this time, I'd like to shift over a little bit. Dr. Washington talked a lot about COVID-19 and underserved communities, what that means, what places some people at risk. So Dr. Udemba is going to talk about, let me repeat that. Dr. Udemba is going to talk about how the Mississippi State Department of Health is working with these underserved communities to fill in some of the gaps that Dr. Washington talked about in her presentation. So at this point, I'm going to turn it over to Dr. Udemba.
All right. Thank you, Dr. Melvin. I appreciate you for the introduction and allowing me to be here. Definitely want to talk about the things that are going on from the Mississippi State Department of Health standpoint and what we've been able to do to really address the issues that we're talking about as far as health equity and disparities. I think Dr. Washington talked about a number of great points and issues that arose once we started looking at some of the numbers and issues that were going on around COVID-19 and the things that were highlighted around the disparities that exist in our state. And so with that, we looked at early on in March, the Mississippi State Department of Health, we were able to identify some of the issues that were going on around COVID-19 in Mississippi. And it really started with us looking at the numbers and looking at epidemiology and those techniques to really look at what is COVID-19 doing within our communities, and from a bird's eye view, and then kind of drilling down into those numbers and what those means. And as we grew rapidly in the state, just like any other state across the country, we started to see different disparities pop up and really started to understand that these disparities were truly affecting communities of color as well as low-income communities. And so after seeing those disparities and finding that out, the health equity and Disparity Response Unit was formed by the Mississippi State Department of Health's Office of Preventive Health and Health Equity. And we were able to come together and develop a plan of action to really address those different things. And we're really focusing on accelerating the delivery of culturally appropriate educational materials. We wanted to educate on protective and social distancing measures and to significantly increase COVID-19 testing in our communities of color as well. And so with that plan, we were able to put together a plan based on our Community Engagement Center. And that really focuses on informing the community, consulting the community, and then involving the community. And so what we want to do is be able to give the community education around what is going on so that they can have an informed decision on the different things that are going on, especially in the age of misinformation. There was so much misinformation that was coming out around COVID-19 that was really confusing the community. Even the well-educated individuals in our communities were confused. And then you also had so much issues around so many different languages and communications that were coming out. You had the presidential administration that was that had something that came out that was different from the CDC, that was different from the governor's message, that was different from our local messages. And so from the health department standpoint, we wanted to be able to provide some recommendations that were important, but also facts that were based on different things that individuals can utilize to make informed decisions about the different activities that they want to participate in. In doing so, our next step was to really consult those communities. And that means that we were able to try to tap into the communities, connect with those communities, and get some feedback from those communities so we can make decisions on how we can implement some real strategies to mitigate the spread of COVID-19, and also involving those communities in those strategies, making sure that these stakeholders and our communities as a whole are involved in this and making the decisions that are necessary to really protect our communities and slow the spread of COVID-19 within African-American as well as other minority and immigrant populations within the state. And so, as always, we rely on community level partners to really expand our public health's reach, but really to understand those vulnerable populations and understand how we can really connect with them and give them the information that they need, but also understanding where they are and meeting them where they are. And so we used a 4-layer approach to address the disparities and the impact of COVID-19 had on African Americans, as well as some of our other subpopulations. So we know that there was a huge issue among our Choctaw population in the state, as well as our immigrant Hispanic and Latino populations in the state as well. And so with that, our first step was looking at education dissemination. We wanted to make sure that people had the right information and also taking the time to really dispel those myths. A lot of times we get focused on just putting out information, but we also have to address those issues around the information that people already had that was really leading them in the wrong direction. And how do we address those different things? I know early on we talked about, we're bringing up this point all the time, that African Americans and Black people did not feel that that Black people could get the virus. And then we found out that we were most disproportionately affected by it. And so it was really making sure that we understood that people might still believe this and really addressing those information as well as providing them the information that they can utilize to protect themselves during this virus. And so we worked on different opportunities and ways to connect with the community to provide them the proper education material, but as well as finding ways to connect and make sure the message resonates with those individuals. So utilizing PSAs and different things of that nature so that it fits within the realm of understanding and it's culturally appropriate to the communities, not just for those that are educated, but those that may not be educated or those that are not looking at in the same arenas. So not everybody has live cable. There might be different ways to reach those people that are utilizing YouTube and putting commercials on YouTube and other social media platforms so that they can we can tap all of the communities as well. And so the next thing was COVID-19 testing. We understand that testing is an extremely important part with trying to track this virus and how it's spreading, and also with trying to do what we can to slow the spread. Having testing sites that are available and accessible to the community is very important. We know early on a lot of people did not have trust for different things, but also access just was very limited. Only certain people could get testing early on. You have to have symptoms. You have to have access to certain facilities and all those different things. And that prevented a lot of people that were low income, or for those individuals that were essential workers, or even those individuals that were migrants or people of color, prevented them having access to those testing sites. And so we really wanted to find ways to connect people to testing sites and create those access to our different communities that are in our vulnerable populations. Resources and referrals, I think that's a really key and important part. We can tell people to wear a mask, but if they don't have access to those masks, if they can't afford those masks or utilize those masks, it's really important that we provide them those resources so they have that, so they can protect themselves and their families, especially for those individuals that are working in those high spread, high contact areas that put them at a higher risk than others. And then finally, our last strategy is utilization of COVID-19 data. So we have information out there. We're learning as we go. Scientists, public health practitioners, healthcare professionals. This is new to everybody as the community, to the community as a whole. And so we're utilizing information that we get from this, and then we're taking that information in, synthesizing it, understanding it, and then trying to take that information and utilize it as a tool to implement strategies to really help our community as a whole. And so the data piece is really key and important for us to make sure that we're able to see what's working, see what's not working, and then put our resources behind the things that are working so we can really help our communities as a whole. And so with our Health Equity Response Unit, like I said earlier, our key piece was partnerships. Collaborating and community engagement is really key and important with the work that we've been trying to do. We know that from the health department standpoint, we cannot do this alone. It's a partnership, and we really look at this from a community perspective. And it's really trying to find the different partners that are there that can help us implement this 4-layer approach. And early on, some of our key partners were Head Start centers, schools, elected officials really took a hold of this opportunity and took advantage of this opportunity to really help their communities, especially for our small towns. I know a lot of times small towns don't have the same resources as some of our metro areas. And so it's really helpful for our small town elected officials to take this on to really try to mitigate the spread of COVID-19 within their communities. Faith-based organizations, us being in Mississippi as a Bible Belt state, as you will, understanding how important faith-based communities and organizations are within our communities. And so utilizing those partnerships to make sure that we create access was really key and important. Our historically Black colleges and universities, all 5 of them were on board and able to participate and really drive the bus on a lot of the different activities that we were able to do as a response unit. We were also able to develop a Hispanic task force for our Hispanic communities, and understanding the different needs that they have, especially for our undocumented individuals, but also for our non-Spanish speaking Hispanic community as well, for those indigenous individuals. And then, of course, we're able to tap into sororities and fraternities, different coalitions, and some of our social media influencers as well. And so with education dissemination, we were able to really look at what are some of those culturally appropriate documents that we can create, as well as documents that are in languages and understanding for different communities. We want to make sure that the education materials were specifically tailored to the target population, making sure that it showed people of color on them, or that they were at the reading level that is appropriate, especially for those individuals that are not highly educated as well. We looked at opportunities to participate on video PSAs, tapping into influencers like Bobby Rush and some other individuals that could really push out that information to our community as a whole, and making sure that they are part of these messages so that it's relatable to those individuals in the community, and take it on. So we really were focusing on safety measures, guidelines, and of course, raising awareness around washing your hand, wearing a mask, how to identify the symptoms, and then how to avoid the spread of different things, like if you're sick, staying home, and all those different guidelines and measures that would protect us in our community. And so with that, we were able to partner with a number of different individuals. What was extremely popular were the posters and the postcards that we were able to pass out in the community, having them at churches, having them in grocery stores, especially with community organizations that are within the communities that had a number of different people that were coming in to get food boxes and things like that. Having that information that would be available for those groups was extremely helpful to make sure that it was reaching those individuals that needed it the most. We're able to do a number of different PSAs that involved African-American celebrities, elected officials, pastors, HBCU presidents, as well as other influencers, comedians, and of the like. But I will say one of the most helpful things that we were able to do were hosting virtual town hall meetings. And we were able to host them for elected officials, pastors, HBCU presidents, Hispanic community, as well as millennials and Gen Z. And that was an opportunity for us to have meetings and open discussion and open dialogue via Zoom and other platforms where we can have people ask questions and voice their concerns about their communities, raise awareness about issues that the community had that we weren't aware of from the health department perspective. And so it was an open dialogue where we can provide them accurate information, provide them information about what was going on in the state, as well as what's going on in the community as far as the number and the data is concerned, as well as what is the science telling us about this virus, but also get perspectives from the community about what we need to do to help them implement the safety measures that they need. And so a number of different things that came out of that, especially with distribution of resources, as well as hosting testing sites within the community, were some of the things that we were able to get out of those virtual town hall meetings. And so with our testing site, we were able to collaborate with a number of existing partners to establish testing sites specifically within the population and to the population. And so we're able to partner with a number of different groups that were able to set up as testing sites, so our HBCUs, as well as a number of community groups and organizations in our faith-based population. And understanding that our minority populations were suffering at a higher rate, we really were able to change the protocol. So initially, the protocol was that the only people that could get tested were those individuals that had symptoms. But understanding that we were, as far as an African-American population and community, we were getting infected at a higher rate, we understood that that might not be the case, especially for those asymptomatic folks. And so we were able to change the protocol to allow that anybody that wanted to get a test, especially if you were a person of color, you were allowed to get that test and make sure that we're able to track those individuals, especially for those asymptomatic individuals, so that they're able to have access to testing, and we're able to test as many people within the community as possible. And so we're able to identify other possible sites, partnering with groups like our Head Starts. We're promoting those testing sites within the population to let them know that they exist enough time so that they are able to make plans. We understand, and that was brought up with Dr. Washington earlier, where there's a lot of people that it's hard for them to just take off work. And so if they learn about a testing site that day, they just can't take a lunch break and go get tested. They might need some extra time to figure that out. So promoting it within the community so that they have enough time to plan and get to those testing sites, utilizing our faith-based organizations, our HBCUs, as well as also partnering with our FQHCs to test within the Hispanic community, but also have follow-up and connect those individuals that did get tested to those federally qualified health centers post those tests in case they need any type of follow-up as well. And so when we talk about resources, one of the key things that we talk about and that we focused on is being able to have access to those individuals within our vulnerable population, especially during this pandemic. Early on, we know that it was so hard to get a hold of resources. Early on, Lysol, disinfectant wipes were all gone extremely fast. You were waiting in lines at Kroger and Walmart just to get there, and you get there and the last one is gone already. Things like paper towels, all those different types of things were gone off the shelves. And so it was really hard for those individuals that work long hours or didn't have the funds to buy those different things to get access to resources to help protect themselves. And so we really wanted to make sure that we find ways to increase those access to the communities. And so we started a distribution program that allowed people to have access to masks, sanitation supplies, thermometers, programming for managing their chronic conditions while during the pandemic, possible medical supplies and other potential supplies that community may need during this time. Just because we're in the middle of a pandemic doesn't mean people stop having diabetes or people stop having hypertension or people stop needing their medication, right? And so we're looking at this opportunity to connect those individuals in a safe way, in a cautious way, so that they're able to still have access to their supplies and the needs like that. We know we've had a number of discussions especially with our senior population that didn't want to get out and about because they were afraid to go to their doctor or afraid to go to their pharmacist to get access to different medication or different items that they need to protect themselves during their other chronic conditions. And so finding ways to balance that out and making sure that there's access to those different things was key and important. Especially in a state where transportation is very much an issue. And if you don't have access to those transportation, especially for those in those transportation companies that were afraid of COVID-19, if you were even exposed to COVID-19, you may not have tested positive. A lot of those transportation companies would deny people access to the transportation. And so how do we kind of connect those gaps? And that's what we really focusing on through our response unit in that way as well. And so to date, a total of about 413,000 community masks, 124 children masks, and 67,000 hand sanitizers have been distributed across the state. And we partner with faith-based organizations, schools, Head Start centers, HBCUs, municipalities, fraternities, sororities, coalitions, community-based organizations, support groups, and shelters. And I think this was as of the beginning of October, and to date, I think we're over 1 million masks distributed across the state now. And so we definitely are very grateful and thankful for our different community partners to help distribute those masks and hand sanitizers to community, especially for those children's masks, and trying to get prepared for returning back to school and making sure that students had access to those masks so that they can protect themselves. I know a lot of times, we go out and about and we as adults remember to protect ourselves, but sometimes we forget to protect our children with these masks. And so it was a great opportunity to make sure that our children across the state had access to these masks as well. And just a couple of examples of some of our key partners that were able to do so: Lanier High School, Georgetown Community, Galloway School, and a couple of other key partners that helped out to distribute masks across the state. And so I definitely want to kind of give an example of how we utilize data. One of the key things that we're able to do was to create and develop a community health survey, as well as developing maps. And so with that community health survey, it was an opportunity for us to really get a better understanding of trust and influence within our communities, to understand where people get their information and how we can really address those communities via PSAs and targeted educational programming. And so in April, we were able to distribute the survey to about 6,000 people. And so nearly 99% of Mississippians indicated that they're practicing social distancing, but approximately 25% of Mississippians would like to better understand how, why, and when they should be practicing social distancing. So that we understood that a lot of people thought they were doing social distancing, but they weren't really sure whether they were doing it right or not. And so it was really an eye-opening opportunity for us to really kind of create education around the appropriate meaning of social distancing, and really give people an underlying understanding of what social distancing means, other than just staying away or staying at home, or the 6 feet rule. So what does that really mean? And contextually, in a day-to-day life, in multiple settings, what does social distancing mean? And how do we educate the community about that? We understood that a lot of Mississippians trusted the advice of medical professionals, but we also understood that people got a lot of information and influence from the CDC, the State Department of Health, and a couple of other key officials like the state health officer or Dr. Fauci with NIH. And so a lot of people had concerns about who to trust when looking for accurate information, and how do you tap into that information. And so a lot of people had general concerns about leaving their homes to get supplies, where to get those supplies, and then how do you pay for it? That was a really key concern within especially our communities of poverty and communities of color as well. And so people believe that COVID-19 is a serious threat early on, but as time has gone, we know, like Dr. Washington talked about, was COVID. People are starting to get COVID fatigue, and now we're starting to get relaxed, and it's hard for us to kind of stay vigilant on top of those different things. And so it was opportunity from this kind of understanding that people take it seriously. They believe it was real, but now we're starting to see that shift. And how do we really kind of maintain that enthusiasm and the vigilance within the state to make sure that people are taking it seriously continuously, especially as we move into a second wave. And the other thing is that a lot of our communities, especially our communities of color, believe that there's not enough testing within the community. and how do we create access in that way. The other part that we're able to utilize is developing COVID-19 maps. And so these are some of the key maps that we're able to develop, and understanding that some of the darker regions within the state show an overlap of multiple things. So there's an overlap of some of those key risk factors for death among COVID-19 and COVID-19 infections. And so with those darker areas, we can see that obesity, hypertension, diabetes, and stroke as well. Those darker areas that have those high rates of hypertension, high rates of diabetes, high rates of obesity also tend to have some of our higher rates of COVID-19 deaths. And so with that, it's really trying to helps us to key in to those areas to really address those issues for both those chronic conditions, but as well as finding ways to mitigate COVID-19 spread within those areas, making sure that we have accurate testing and adequate testing in those areas, that we have access to sanitation, that we have access to masks, and we really try to educate the community about the importance of social distancing and different ways to do so. And so utilizing these different types of maps has really kind of guided a lot of the work that's being done within our communities, utilizing our community partners, as well as how do we strategize, implement strategies from the health department's perspective as well. And so that wraps up what we've done from the state perspective. And I just thank you for participating and listening to what we had to say today. And if you need access to resources or anything like that, you can always contact the office at 601-206-1010. Thank you.
Thank you so much for that information, Dr. Udemba. You and Dr. Washington actually provided me so much information that although I have some questions pre-written, I think that it's probably more appropriate for us to follow up on some of the major points that you each brought out in your presentations. So this question that I'm about to give you is, I would like for both of you to respond to, because I think, Dr. Udemba, you take it from a community-based perspective. Dr. Washington, you're looking at it from the medical healthcare provider perspective. So my question is, what do you say to people who think that you're infringing? And I'm going to start with you, Dr. Washington. What do you say to people who say that you're infringing on their rights by asking them or even mandating for them to wear a mask?
Yeah, so I think that's a really great question. You know, really what we are all about is preventing spread of disease in the community. And so by wearing a mask, it's not infringing on one's individual right. You're really working to protect those around you. So the mask protects you, but it also protects other people. If you're not breathing in and out the viral particles that are in the air around you, if people are talking or singing or coughing or sneezing, you are really at increased risk for getting the infection. And so really what I've talked to people about since the pandemic began is, you know, it is a temporary discomfort, but you're really working to improve your community overall in stopping the spread of COVID-19.
Dr. Udemba, I'd like you to respond to the same question.
Yeah, I think Dr. Washington is absolutely right. I think one of the things that has been highlighted during this pandemic is how interconnected we are as a community. Mm-hmm. And understanding that we're connected, in, you know, the things that we do doesn't just affect ourselves as an individual, but it affects us as a community. It affects your family and those that you're in contact with. And so when we talk about wearing a mask, it's not just about protecting you, but you wearing the mask for the people that you love, right? We wouldn't want to be the person that goes out because we want our individual right to not wear a mask and contract COVID. And then we go home and then we spread it to our family. And then we end up having individuals in our family have severe reactions to the virus. And so it's really, again, coming together as a community, understanding that we're really interconnected more so than we ever really realized before. And how whenever we wear that mask, it's not just about us, but it's about the loved ones that we have, that loved ones that we come in contact with, as well as the community as a whole, to make sure that we protect ourselves and that we can move past this in a healthy and in a safe way as well.
Okay. Dr. Udemba, I want to follow up or ask you something related to that. You know, public health, and I don't know that everybody understands that public health also has another function, and that's the function of enforcement. So when mandates are put out, they do have a role in enforcement. During this pandemic, I know that we had several executive orders about mandating masks, and the Department of Health, I've seen several statements by Dr. Dobbs, kind of giving us guidance. Have there ever been any discussions about enforcement of it? What the Department of Health could do to enforce it if this got to a point where we really needed to make sure that people did it? And to use an example, TB. There are enforcement measures for people who have TB that refuse to follow the guidelines. So did you ever, during your talks as a unit, discuss the possibility of having to do that?
Yes. So enforcement is definitely a interesting and difficult topic with doing so. I think early on there were discussions about how do we enforce something like a mask mandate, especially with the resources that we do have in hand, and what does that look like? There's a balance with enforcement as well, because we understand how sometimes we enforce things. It's still relatively subjective sometimes. And the way we enforce things, is it really going to be enforced equitably, or is it going to affect one group or one community more so than the other? And so there's a number of different discussions of how do we make sure that we're able to enforce this to protect the community, but also not create more disparities within certain populations compared to others. And so some of that, some of those discussions were hard to kind of get to a conclusion. And so with that, some of it is really going to be based on institutions and how we enforce things through institutions, and then allow those institutions to really enforce those different type of mandates within their own communities. So whether it's schools and the school systems, or hospitals and hospital systems, and different entities in that nature.
Thank you for that. Dr. Washington, since school opened, 1,459 teachers, staff, and 2,949 students have tested positive for COVID-19 here in Mississippi. From a healthcare provider's perspective, do you feel that it's safe for children and teachers and staff to go back to school?
Yeah, so that's a really great question as well. Really since the pandemic has begun, initially in the early spring, school was let out, and now we're into a new school year. There have been multiple opportunities to be able to allow the schools to open in a safe way, but understanding that many times, depending on the age of the child, it's very difficult to keep a child in a mask for the full school day. So we understand the dynamics of that. With that being said, there are other things that can happen. Protective shields being placed in between the student's desk, keeping the desks spaced apart. But we understand that a lot of schools are already at high capacity. They may not have the ability to space the desk out or put the students in the additional rooms because of a decreased number of teachers. They may not have teachers' aides to be able to go into those spaces. And so really, I provided several school systems with guidances regarding how to reopen schools safely. And most of them do include having a plan to decrease the class size, to really enforce sanitation, even if it's done outside of what the school's environmental service workforce does. There may be some things that are individualized with the teachers, with the students specifically, as far as keeping their areas and their spaces clean. And then the number one thing that I have been advising all schools that regarding school openings is make sure you have a plan in place and have a set point of when it is appropriate for the school to shut down. Because we know that kids are going to become infected, teachers are going to become infected at some point. And so you really want to be able to, number one, cohort those children and teachers, kind of keep one teacher, one classroom of students kind of in the same area. If everyone is going to multiple classes, say in a middle school or high school where classes change and someone has 5 to 6 teachers over the course of the day, and students are interchanging through the classes, well, that's when you get a very large outbreak within the school, and then you have to close down the entire school. So sometimes you have opportunities where only the classroom will have to kind of be quarantined and those students will be sent home. But when you really have no good way to isolate those people groups, then you get very large outbreaks within the school, requiring the entire school to close down.
Okay. I guess that's something that when we're thinking about moving into a second wave of COVID-19 and it's getting cold, that may be something that we have to think about. I really want to shift focus. We've talked a lot about prevention, but we know that now we're beginning to shift towards thoughts about vaccination. And we know that for public health, that's one of the greatest tools in our arsenal, vaccination. And so I want you both to respond, but I'm sort of from different perspectives. Dr. Washington, as a physician, I want you to respond to the safety of participating in clinical trials for vaccination. And Dr. Udemwa, I want you to respond to, in the emergency response unit, are you having discussions about what messaging should look like to get minorities to consider participating in vaccination trials? So we'll start with you, Dr. Washington, and then you can follow up.
Yeah, so when we talk about clinical trials, the current clinical trials that are ongoing, there are multiple pharmaceutical companies that are doing COVID-19 vaccine trials at this time. Many are currently enrolling patients. Those trials are considered safe. Understanding that when you sign up for these trials, you will either be placed in the placebo group, meaning that the medication you receive, there's no active medication there, or you will be in the test group to receive the COVID vaccine. And after you receive those, you will go through a series of tests, blood tests. They will monitor you to evaluate you for any particular type of side effects that may result from that. You know, these vaccine trials are traditionally safe. I know that there is a lot of concern for patients in the minority populations on signing up for these clinical trials. We all go back to thinking about the Tuskegee experiment and things like that. But really, once the Tuskegee experiment was brought to light, it really signified a change within the U.S. research system and how they go about informed consent, to inform you of what the test actually is, what you should expect from it, what to do if you experience any type of side effects. And so overall, the vaccine trials are safe.
Okay, Dr. Udemwa.
Yeah, so I think that's a really good question about how do we message participation around COVID-19 clinical trial testing for the vaccine, and how do we encourage people to really participate? We understand that a number of individuals still have mistrust around science, still have mistrust around the government, and especially during this time with so much polarization and politicizing of the vaccination in itself. Recently, we know that creates a lot of mistrust and issues with that. And I think really some of the key early on discussions around how do we message and we package that is really about building the trust within a community. So understanding that from a state standpoint, we're really looking at the health and concern of our communities, and that's for all citizens in the entire state. And this is an opportunity for us to really address those health issues, as well as not, shying away from the concerns that people have around the past with the Tuskegee study and all these other different things, and making sure that we address that and inform people of the advances that have been made based on some of those issues around those events that happened in the past and what we've done to mitigate that moving forward, as well as why is it important for our community to participate. There's so many different clinical trials that minorities are not represented in, and we're going to the doctor and we're being prescribed these medications, and we don't have an understanding of how it really affects us until after it hits market. And it'd be best for us to really have that understanding prior to it hitting market for our communities. And so it's really important that we participate and protect our own communities by participating in this in these clinical trials, so that we know how it affects us and our people, so that we're able to protect the community moving forward once those vaccinations are here. And so we're really looking at how do we really address mistrust and also gain some of the trust in the community, as well as providing information around importance of being able to participate and taking this on as a community instead of waiting on them to come to us. We need to go to them.
Thank you. So I do want, as we wrap up, you to consider what would be the message you would like to leave for the audience. If you could just tell them one thing that you want them to take away from this presentation, what would it be? We'll begin with Dr. Washington and then Dr. Udemba.
So I will end this COVID talk the way that I have ended multiple COVID talks that I have had since this pandemic began. You know, it's very important that we remain vigilant about everything that's going on. It's important that we appropriately wear our mask. When I say appropriately, I mean the mask that is covering your nose and your mouth. It is important that you wear that when you're outside of your home, or even if you are inside your home with people who don't live in your house with you. That is one of the proven ways to prevent the spread of COVID-19. It's important that we wash our hands. When we say washing hands, that is 20 seconds using warm water and soap, and to dry the hands completely. It is important that we maintain our distance between one another. The recommended distance is 6 feet. If you have to be closer than that to people, it's important that you limit that time. The recommendations are for less than 15 minutes, and you do need to be masked during those times. I will circle back to the holiday season that is upon us. Please make sure that you remain cautious about exposures. Having people outside of your home, going to other people's homes to have Thanksgiving dinner is very high risk. There are people that I know personally who have had laxity with their social gathering, and they have had multiple members of their family to contract COVID-19, and multiple people died. There is one young lady who is one of my fellow physicians. Just this week, 3 of her family members have died from COVID-19. And that really is something that is not acceptable during this time. We know things that are preventative. That is what we know works for sure. At this point, we don't even have a vaccine that is available right now. And so we cannot hang our hat on that a vaccine is coming. We need to do what we need to do to stop this infection right now. And really, if we hunker down, probably for 3 to 4 weeks, we could really be looking at this, the numbers significantly decrease. But it's important that we do that as a community. Many of us have been doing what we are supposed to do since the pandemic began. And so now when we have this time where we're in the 8th, 9th, 10th month of this pandemic, we're really getting to the point where we're tired. Healthcare providers are really stretched very thin, and we really want everyone to remain safe. So that's my closing message.
Thank you. Dr. Udemba?
Yeah, thank you. I think that was really, really great, Dr. Washington. I will say, you know, we're not through this. We're not close to the end yet. It's really key and important that we do stay vigilant. It's going to take us as a community to really slow the spread, stop the spread. It's not going to just be one person staying in. It's not going to be just one person, one family wearing masks. It's going to take us as a community to all stay vigilant. I know we're all tired of having to stay in. We all want to get out and about. We had all types of activities canceled, from weddings to vacations, a number of different things. And people are frustrated and ready to get back to doing normal life, but we're not there yet. We have to stay vigilant. We have to take advantage of all the different activities, prevention measures, resources that are available to us. to be able to make sure that we're doing this. If you do feel sick, stay at home. If you've been exposed, don't be afraid to go get tested. I know for a lot of people in our community, we just don't want to know, but that doesn't help us as individuals. It doesn't help us as a family. It doesn't help us as a community. If there's a possibility that we might be positive, we need to go get a test. Understand that and know that we're positive, so we can do what we need to do to protect ourselves and our community and our families. And so I would definitely say that we continue to stay vigilant. We continue to do all the things that we need to do to make sure that we're protecting ourselves, our community, as a family. And the best way to get through this is as a community. And so as we continue to live our day-to-day lives, make sure that we're looking out for our neighbor and doing the best that we can to make sure that we protect our families and our community as a whole.
Thank you so much. And so as we wrap up, I just want to say to each of you, thank you so much for the work that you're doing in the community. You're in the trenches every day addressing COVID, each of you from different perspectives. You, Dr. Washington, as a healthcare provider, you get to see it up close and personal every day. You, Dr. Demba, you're actually there from the public health perspective, trying to figure out how to make safer communities. And so I really appreciate the work that you're doing and the information that you have provided today. I want to thank you for taking your time to talk to us about these troubling times that we find ourselves in today, and also giving us information on how to stay safe, how to keep our families safe. So just reiterate what both of the panelists said. Please practice social distancing, wear your mask. If you think you're sick, get tested. You can go to community health centers, contact the Mississippi State Department of Health if you don't know where to go, and see where they will be testing. So we just want to make sure that our communities are safe. If you have any questions for either of the presenters, you can send that information to us, and we will add that information at the end of the presentation. So to everyone, thank you for watching, and we look forward to working in the community to keep us safe. Thank you.